welcome to Burgess News Reviews. I'm your host, Don Burgess. And with us today, we have Dr. Joseph Froncioni. Welcome.
Good evening.
And Dr. Annabel Fountain. Welcome to you as well. And I love your view. You're outside getting some vitamin D and enjoying
That's right.
a slight breeze. We're here to talk about the Bermuda Medical Doctors Association. And last month, the BMDA wrote a letter. Why did the association decide this was necessary? Dr. Froncioni?
We decided that vaccination needed a push, and we picked vaccination because this vaccine is probably the safest and most effective vaccine ever developed by mankind. And in this beautiful country, it's free, available to everybody, regardless of position in life, income, and it's a shame that not everybody is availing themselves of this wonderful vaccine. So we decided to see if we could increase the number of vaccinated people in this country by doing some publicity about it.
Dr. Fountain, is there anything you want to add to that?
Yes, I think the current surge that we've been experiencing here and around the world is really terrifying for everybody. I think Bermuda got rather complacent because we did so well last year, and people who were not vaccinated probably felt pretty safe. And now we're looking at people dying who really didn't need to die. If they'd been vaccinated, they were much less likely to die. So I think it's been really devastating for the medical community. We love our patients. We spend a lot of our lives, half our lives studying to be doctors and then being doctors. And the whole point of us is to help people be healthy and keep them alive. So actually, when that's all going wrong, it feels like we're failing. And we have the science, we have this amazing technology that's been developed not over 18 months or whatever was proposed, but actually over decades of science, and people are not having it, and it's very sad. I think that's why we were moved to write a letter.
I think one can say that this has become a pandemic of the unvaccinated, which is pretty sad.
Very sad.
Now, when the letter was written back on September 24th, there were 45 deaths. Now there are 87. So in a little over 3 weeks, we've had almost the number of deaths double. Now, some vaccinated people are dying as well. And I think one of the complaints that vaccinated have is that this vaccine is not working, not protecting people.
I mean, no vaccine is perfect. No vaccine will protect you 100% of the time. So this vaccine is about as effective as any vaccine, more effective than any vaccine has ever been. It's up in the 90s. And you're going to get some people who are vaccinated who get COVID-19, and some people will end up in the ICU who are vaccinated, and some people will die. But when you compare the stats between the vaccinated and the unvaccinated, there's no question that the vaccine offers tremendous protection compared to the unvaccinated.
Yeah. We have to remember about the chronic disease burden that Bermuda has. If people don't know, I'm a diabetes specialist, and I work with people who have problems with their hormones. So mostly chronic diseases associated with obesity. We know from 2014 that 74% of our population is either overweight or obese, with a very high percentage, one of the highest in the world, of people with diabetes. Now, people who have obesity or diabetes have chronic inflammation. And what happens when you catch COVID is that your inflammatory system goes in overdrive. And that's why people get really sick. So if you have a chronic disease and you get COVID, that's really bad news. If you've had the vaccine, it gives you a better chance to for your immune system not to create the cytokine storm that we're talking about in people who've got chronic diseases. So It's not just because we have COVID and that the vaccine is ineffective. It's that we really have got so many sick people in our community. That means that we have to work even harder to keep them safe from this disease.
One more point about the increased deaths recently, Dawn. The Delta variant is certainly responsible for some of that. The Delta variant is much more transmissible and is tending to make people sicker. And like everywhere else in the world, we are victims, and we see the result of this new mutation, the Delta variant.
I ran some numbers this morning, and it showed like over the last 3 weeks, the number of people who have died in the hospital, the percentage of deaths from those who are vaccinated went from 13% to 22% over the last 3 weeks for the vaccinated, and hospitalizations went from 8% to 14%. Is that a sign of what's happening there?
I think those are small changes. It's hard to call those trends, but we are in trouble partially because of this Delta variant, and we're going to see the numbers go up and down because of that.
Most of the transmission of COVID is behavioral, right? So either you stay on your own and you don't come into contact with a lot of people, and you're vaccinated. So those are choices that we make. And if you remember how we were in March, April last year, when everybody, like the world, ran out of Lysol and disinfectant wipes, and we were spraying our groceries or leaving our groceries outside for the virus to disappear off it, and now we're all going around in the groceries. We're not keeping our 6 feet distancing. Our behavior is very, very different because we got relaxed, I think. And I think anybody who has watched how Bermuda managed the outbreaks last year, we did really, really well. And this year, I think that, even when this outbreak started, or this surge, the numbers started, people were still out in bars, Of course we've got a huge outbreak, and of course some of those people went home to vulnerable people who have died. That's what happens.
I want to touch on a point that you mentioned earlier, Dr. Fountain. It was about taking care of ourselves and eating healthy. I mean, I know that's especially true for dealing with people with diabetes. I know that you don't just say take the vaccine, but live a healthy lifestyle as well.
Absolutely. We know that actually type 2 diabetes is a lifestyle disease. It's associated with high intakes of processed foods and simple carbohydrates. And so if you do have diabetes and you can look at your intake, your nutrition, you can actually make a massive difference to your health by changing the way that you're eating. I decided to sit outside, and I hope the traffic isn't causing too much disturbance. But, I've been working all day and I'm out here for my vitamin D. We also know that there's a huge correlation with vitamin D deficiency and severe coronavirus illness and death. And we know that in Bermuda, we have a lot of vitamin D deficiency, partly because our population is mostly Black. And people with high pigment in their skin, they've got natural sunscreen, and sunscreen blocks the development of vitamin D in our skin. So a lot of our Black population do have vitamin D deficiency, and that comes along with poor nutrition as well. So when we are looking at the health of our population, there are a lot of things that can be done without medicines, without doctors, actually, to make us healthier and less susceptible to diseases like this.
Dr. Froncioni, did you want to jump in and add to that?
No, Annabel's the expert.
Okay. All right. Now, are you two both still encountering people who don't believe COVID is real or don't believe in the vaccine?
Absolutely. So I'll tell you, at the beginning of the pandemic, when we started getting vaccinated, I would welcome a patient into my office and do my history and physical examination. And only at the end of the visit would I say, and by the way, are you vaccinated? And if they said no, I would say, listen, if you have a couple of minutes, I'd be happy to answer your questions. And most of them would sit down and I'd answer the questions. And my success rate in convincing them must have been 50% or so. But with what's been happening recently, I've changed my protocol now, and I call the patient in, and the first question I ask is, are you vaccinated? And a lot of people say, no, doctor, I'm not. I would say a fifth of the people I see will say, no, I'm not. And my next question is, why not? Some people don't like that. They say, doctor, it's a personal choice. And I tell them it's not really. For the next 20 minutes or so, I'm going to be breathing your air and you'll be breathing my air. So it's not really a personal choice. So you'll have to let me speak to you about the vaccine, because it's not personal. I am breathing your air right now. And so I've become a bit more aggressive about my advocacy for vaccination. And I'm not sure if my other colleagues are doing that, but it's something I do every day.
Yeah. All of my appointments, we have I wouldn't say all of them, but 90% we have a conversation. I've had a few people today. We always think that the people who are going to die are going to be older or infirm, etc. But there've been some really young people who've died of COVID in our community over the last few weeks. And two of my patients today were very closely related to two of them. So and one of them was vaccinated and the other person wasn't. And we had a discussion. I think, I talk about, why I always have the flu vaccine, although I haven't had it yet this year. Last year, we had hardly any flu cases because everybody was masked. And flu is also a droplet infection transmission like COVID. So actually, the way that we protect ourselves from COVID actually protects us from flu as well. But I've always had the flu vaccine, not because I'm going to die of flu, but because if I give it to one of my patients, they could die. So that's why healthcare providers are often the first to accept vaccinations, because it protects their patients. And one of my conversations, I think it was today, was about the public health of our community. If everybody was vaccinated, these people would not be dying now. They wouldn't. Very few of them would be dying. And we wouldn't be in this economic crisis with businesses not being able to function and our tourism sector collapsing. So it isn't just, it's a personal choice, but it has a global community impact when people don't take advantage of this vaccine.
Now, one of the things that I think some people who haven't taken the vaccine is that they say was developed too quickly. They don't want to trust it, and they want to wait and see down the road, what side effects possibly could be.
I can address that. First of all, we have been vaccinating, and I'll use quotation marks, we have been doing some form of immunization since the 15th century. The Chinese were using a form of varialization. Edward Jenner is the guy who really developed something close to vaccination at the end of the 1700s. But it's been an awful long time, so we know a lot about vaccines. And one point that people always bring up is we don't know the long-term side effects. We know for the entire history of vaccination that most side effects appear within days, weeks, to months at the longest. It's extremely rare. I don't remember a vaccine. I'm not a vaccine expert, but I've read a lot about vaccines, obviously, and I don't remember a vaccine that has long-term effects. This vaccine is using technology that's been worked on for several decades. RNA technology started with Ebola, SARS, and MERS, and has been developed. And it was a technology just waiting for a pandemic to be developed. All of the pieces of the puzzle came together. CRISPR technology, the cutting and pasting technology for genetic material, the vehicles to transport the mRNA and to make it an appropriate vaccine. All of those things came together with tons and tons of money being poured into the technology at once. I mean, things that were done to speed up this vaccine have never been done before. So normally vaccines were developed in a linear way. You start doing basic research, then you do animal research, then you do small trials in humans, and then big trials, and then massive trials. And then once you have a vaccine that works, then you build a factory, a very complex, very costly factory to build that. That's a linear process that typically took 5, 10, 15 years. The time was cut by making this process for this vaccine non-linear. So instead of waiting 3 or 4 years to build a factory, someone with lots of money said, here's the billions of dollars. We're going to build you a factory now. When you're ready, you move in and start using it. So that cut years and years. Instead of doing a small trial, a medium trial, and a big trial sequentially, they said, we're going to allow you to do all 3 trials in parallel. We're going to analyze them the same way that we used to analyze them, one after the other, but we're going to analyze them in parallel, so that the years that were cut from the development of this vaccine, I mean, I can't count the number of years that were cut out.
Okay. Now, some people are concerned about myocarditis and for blood clots being caused by the vaccine. So if you can just give us a little bit more information about, what age groups or what genders maybe that this is affecting and how prevalent it is.
I can give you the AstraZeneca vaccine is the one that people really worried about in terms of clots. And I'll just give you an idea of the relative risk of getting a clot in different circumstances. So if you get the AstraZeneca vaccine, you generally see 4 cases of blood clots per million. Okay, that's 0.0004% of patients will get a blood clot. Many of you have daughters, or many of you are on the birth control pill. The incidence of blood clots for the birth control pill is up to 1,200 cases per million. If you're a smoker, nearly 1,800 smokers out of 1 million will get a blood clot. But that's nothing compared to if you get COVID. If you get COVID, 165,000 people out of 1 million will get a blood clot. So when you measure all those things up, it really puts the risk into perspective. Annabel, you probably have more intelligent things to say about this.
I don't know, because I missed a bit of the beginning, but I agree with you about the statistics. COVID itself is what's called an endothelial disease. Like, it actually affects the inside of your blood vessels. And so if you catch COVID, then it causes inflammation of the inside of the blood vessels and increases the risk of clotting. And that's why the disease itself causes death, not only from pneumonia, etc., but also blood clots and pulmonary emboli. But it'll be all little ones, and that's why people get the difficulty with breathing when they first get COVID. Well, not when they first get it, but when they start getting bad symptoms. And that's why their oxygen levels are dropping, because their bodies are suffering from low, not being able to conduct oxygen because their lungs aren't working properly. So it's very, very scary. But definitely the virus itself is much more dangerous than the vaccine, or and even than the AstraZeneca one, which had the higher rates of clotting.
Now, I want to get to Shawnette Sumner's question, but before I do, I want to finish up with the second part of this question. I know with the mRNA vaccines, myocarditis in young men seems to be a concern. What can you say to that?
I think it's the same as with the blood clots. Your risk of getting myocarditis from COVID-19 is much greater than getting it from the vaccine. And the other thing is that most people who get myocarditis, most kids who get it, or most, it was felt to be males more than females, recover from it.
Yeah.
Okay. Now, Shawnette Sumner has a question. She says, can someone please explain how getting the vaccine allows a person to protect another person?
Sure.
Okay, so if you are unable to develop the full-blown disease in your own body, right? If your body is stopping, because your own immune system is stopping the virus, the real virus, from replicating and growing in your body, okay, because we're the host for the virus. The virus comes along and it uses our cells to make more virus. That's how it grows. And then if then those little viruses are in our airways, and we breathe on someone or sneeze on someone or cough on someone or share a cup with someone or whatever, then if we've got lots of virus in our system, then we're going to spread lots of virus. If your body has an immune system that stops that virus from growing, then the level of virus in your airways is going to be a lot lower. And then you can imagine that if that person sneezes, who's vaccinated, or has very low virus levels in their airways, then they're going to be much less likely to infect the next person than somebody who's got the virus that can just grow exponentially in their body because there's nothing stopping it.
Maybe stated another way, vaccinated people may at some point have the same viral load in their nose and in their mouth, but that viral load diminishes very quickly over time because they're already prepped with specific antibodies to kill that virus. Someone who is unvaccinated has to mount an immune response. The body has to say, hey, these viruses don't belong in my body. I need to get antibodies to kill them. And that takes time. That takes weeks to develop a strong immune reaction. It doesn't take weeks in a person who's vaccinated, because that's what the vaccine does. It has stimulated your natural immune system to produce ready-made antibodies ready to attack anything that looks like COVID. So as soon as you get that big viral load in your nose and in your mouth, your antibodies are ready to go. So at some point you have the same number of viruses in your mouth and your nose. And if at that point you sneeze in someone's face, you can give them COVID. But very quickly, your antibodies will destroy those viruses, and you will have a viral load which is not big enough to infect someone else. So that's how you protect your neighbor, by being vaccinated. You're pre-armed with antibodies.
Now, we've talked about possible effects to the vaccine, but one of the things that I think kind of just disturbs me a bit here is that we haven't really been talking about the long-term side effects to COVID. I know of 4 people who had it last year who are still suffering from it this year. One person, their taste comes and goes, which is probably minor compared to some of the other ones, but I've seen people with severe fatigue afterwards. What sort of things are you seeing, and how long are people being affected with this?
Well, Don, maybe I can give you an anecdote, and we don't like to use too many anecdotes in science and medicine, but I think it's a good one because so many of my young patients say, I am fit and healthy, I'm a footballer, I eat the right things, and my immune system is strong. By the way, you can't say that. It's very hard to measure the strength of the immune system, but they feel they're healthy and that they can combat it. And I give them the following anecdote. I have a cousin who represented his country in speed skating 2 Olympics ago. So he's a speed skater. He's a monster, okay? And since he went to the Olympics, he continues to be an international class athlete. This guy used to run 10K in the morning and 10K in the evening. He got COVID about, I would say, 12 months ago. And I follow him on Strava. Us runners follow each other. We see how far we run and how fast we run on the internet. And this guy walks slower than my 90-year-old mother about a year after he got COVID. He is a shadow of his old self. And it is the saddest thing ever, from an Olympic athlete to a guy who walks 1 kilometer once in a while. it is so sad to see. So this is the kind of thing that can happen. Now, you mentioned a whole bunch of other things, loss of taste and smell. That is temporary usually. Fortunately, the virus destroys some of the lining of the nerves that take care of that, and that generally grows back. But it is, I've heard, extremely unpleasant. Your food tastes like something I won't mention, and things begin to smell like gasoline and kerosene. So that's most unpleasant. But that generally clears up. But then there are the other long-term effects. They call it brain fog. You just don't feel yourself. You can't think as well, and the weakness and the respiratory problems. Annabel probably has other long-term side effects.
What are you seeing, Dr. Cow?
So I have one friend who was super fit who is still suffering more than a year after, and she's somebody who did everything that could have been to say that she's healthy, more healthy than most people. Very young, in her 30s. So yeah, it was pretty brutal, and she's still not able to get back to her usual level of exercise. I have a friend who has had the myocarditis. He's recovered quite well. Yeah, I think I have patients who have died. So I'm worried about the long COVID, but I'm also, at least those people have the chance of recovering.
We're hearing a lot about booster shots now for people who are autoimmune compromised, people who are 50 and over 60 and over 80. What are your thoughts on getting booster shots?
I mean, the vast majority of vaccines give you an immunity that tends to wane with time. Not all of them. I think that measles, once you're immune, you are immune for life. So there's a bunch of vaccines give you a lifetime of immunity, but not all of them. And we think that the present COVID-19 vaccines will give you an immunity that wanes a little bit. It's still very effective, by the way. I got my first shot January 11. I was one of the first in line with a lot of my colleagues. So if I measured my immunity at the moment, I'm sure it would be diminished. But getting a booster is normal. We get boosters for tetanus and all kinds of, we give children boosters. That's a normal part of immunology, of vaccination. It's expected. Like I said, not necessary for every form of immunity, but we think that for the COVID-19 vaccines, we're going to need a booster. And just like the seasonal flu, we might need a vaccine every year.
Right.
Well, yesterday, WHO approved a malaria vaccine for children in Africa, and they were hailing it as being a success. One of the things that came out in that report is that it's effective in preventing 30% from getting severe malaria. And comparing that to the 30% malaria, 30% effective compared to the vaccines we have for COVID. What do you think that says?
Don, I heard 50%, but let's not bicker about that difference. It just goes to show you how lucky we are with the COVID-19 vaccines. I mean, we're talking 95% effectiveness. The world is popping champagne bottles because we have a malaria vaccine that's 30 to 50% effective. So that's how serious the problem is. That's how many people are affected by malaria, and that's how much of a help of a 30% effective vaccine will be.
Malaria and sort of diarrheal illnesses in the third world are the number one killers, right? So when I was in the South Pacific, that's where I did part of my medical training, there were, if a baby or a young child gets malaria before their brain development has completed, they can get cerebral palsy. So and there are different kinds of malaria. So we're very, very lucky in Bermuda that we have not got the right kind of mosquito to give us malaria, because it really is a devastating problem in the third world.
I want to put to you one of the criticisms when the Bermuda Medical Doctor Association put out their letter was that only 102 doctors had signed it, and if the vaccine was so effective, why weren't there more doctors putting the John Hancock to it?
I have the answer to that, Don, and it's 7, by the way. When the letter was first published in the Royal Gazette, there were 7 lonely signatures on there, and the most glaring part of that letter was the blank space where there were no signatures, and that was an error on our part. That letter was published before doctors got their act together and actually submitted their names. That gave us a huge jolt. And so we called everybody up and said, what's going on? And we now have about 100, the new letter will go out tomorrow or Monday, and there's 150 or so doctors on there. And people say, well, there's 160, 70 patients on the Bermuda registry, not patients, but doctors. How come not all of them are signing? And that's because the registry includes doctors who are retired, doctors who no longer live here, doctors who no longer practice, doctors who visit occasionally and need to be on the register. So we know from speaking to our colleagues that the vast majority are vaccinated and pro-vaccine. No doubt about that.
No doubt.
Okay. I know that was a huge sticking point, because I was standing in line with a woman this morning who was complaining about a large number of doctors who haven't had the vaccine. She was using that as she was saying, like, that was actually one of the reasons that was preventing her from getting the vaccine.
So a large number of doctors didn't have their names on that letter for all the reasons I said, including not being able to get their act together to get their name, to email their name to the.
We're pretty busy, and primary care is even busier. COVID actually creates more work, not less. And yeah, sometimes an email isn't on the top of the list. So.
All right. So I want to give you each a chance to have a last say here as we wrap up. We went over our 30 minutes already, but we'll start with you, Dr. Carter. Dr. Fountain. Sorry.
It's okay. It's okay. I'm used to it. What did you say? I'm distracted by the loss of my name.
Okay. I'm going to give you a chance to have a last word or anything you want to say that I didn't ask you that you feel is really important.
I just ask that everybody who is concerned about their health generally to actually work on that first. If you're not going to have the vaccine, you really have to make sure that you're very, very healthy. But the most important thing is that if you don't have the vaccine and you come into contact with coronavirus or any other viral disease, actually, even if you survive it, if you give it to someone else who doesn't survive, that's on you. Sorry to say it.
Okay. And Dr. Froncioni?
Maybe I'll use my chance for a last word to address one of the most common reasons patients tell me they have not been vaccinated, and that reason is it's a personal choice. And so in society, we sort of are part of a social contract. We have rights and freedoms, and we have responsibilities. That's unless you live on a desert island, all those things are involved in being a good citizen. And your rights and your freedoms to choose sometimes have to be curtailed for the betterment of everybody. Example, drinking and driving. We don't drink and drive, and we don't do it to try and prevent harm to others. We don't smoke indoors. There's a whole bunch. We don't run red lights and stop signs even at 3 a.m. when no one is looking, because we understand social contract, and that social contract means trust. We trust each other to look out for each other, And so we curtail that freedom or that personal choice that you might want to drink and drive. We do that easily. We don't question those things. We wear a seatbelt. We don't question that. And it should be the same thing for vaccination. We have a personal responsibility to help curb the pandemic and to protect others as well as ourselves by using a tried and tested vaccine, the COVID-19 vaccine. So personal choice needs to be put aside, and you need to be part of the team.
When you say personal choice needs to be put aside, are you saying that the vaccines should be mandatory? I know George Holdup.
So the discussion of vaccine mandates is now taking off. Obviously, you want to try and use persuasion more than coercion in any society. But if you look around, I won't talk about Bermuda in particular, but in general, if you look at the States and Canada and Europe, more and more jurisdictions are realizing that unless they move along the spectrum towards coercion, that means mandates, the M word, they're not going to put this pandemic behind us. And we haven't used the M word in Bermuda very much, but certainly I think we should be discussing mandates, especially with selected parts of this community, like healthcare workers and people who work in old folks' homes, and teachers and firemen and policemen and EMTs. I think we need to start discussing that, because that discussion is happening vigorously in other countries.
All right, that's a very strong statement right there at the end. Just want to appreciate having both Dr. Fountain, who I shall not call by a wrong name again. Thank you for being here. And Dr. Froncioni, thank you for being here as well.
It was a pleasure.
Thank you.
Always,
Pleasure.
for Bird News, I've been your host, Don Burgess, and hoping you have a beautiful evening.